Welcome to Big Butts, No Lies. I'm Mavi, your go-to guide for everything plastic surgery. With 18 years in the industry working alongside top board-certified plastic surgeons, I know what really goes down: the good, the bad, and the botched. Now I work for you, bringing you real, unbiased info to help you make the best choices for your dream look. Whether you're going for subtle enhancements or a full-on transformation, I'm here to give you the facts, the tips, and the confidence to navigate your surgery journey. Let's get into it. Should be fun. Hey guys, do I have the show for you today? I am so excited about my guest, and you as a listener are in for a treat. Today I have Dr. Rebecca Knackstedt out of Duke University, and she is an assistant professor there. And you guys, we're about to deep dive into what she's really passionate about. And I'm not going to take up too much of her time to get into it. Thank you for being on the show.
Thank you so much for having me.
I am so excited to have you on. I have been following what you have been putting out as far as getting ready for surgery. And that is one of the key things that we talk about here on the show. One of the most important things is nutrition. And I've had episodes about it, but we've never really gotten into pre and post habilitation, which is something I learned from you. And I'm so excited to get into it.
Absolutely. It is a really important conversation that I think most patients don't have before surgery, but it really can impact so many aspects of healing, recovery, even the aesthetic outcomes.
Absolutely. So for our listeners who are planning their surgery, maybe they already have their date booked and maybe it's in a few weeks, maybe it's in a few months, or it's down the line sometime this year. What is something that our listeners could be doing to prepare for surgery with their nutrition?
Mm-hmm. Nutrition is something that we all recognize as being important just for overall health and wellness. And somehow it just gets lost in the discussions when we're thinking about preparing for surgery. And it's not the fault of surgeons. It's not the fault of patients. It's something that we're not really taught in medical school. You know, most medical school participants have less than 20 hours of nutrition across the whole medical school curriculum. And then we're certainly not taught that in residency because that's focusing on how to do surgery and how to take care of patients. So it's something that just got lost along the line. But there are so many important things that people can do to prepare themselves for surgery. And I think the most important, just the overarching theme, is that when you have surgery, it's this period of stress for your body. Your body is not operating at its usual day-to-day function. So even for patients who think, I have a pretty balanced diet, I'm doing all the right things, even those patients can benefit from some tweaking, some targeted supplementation, and it's been shown in studies that doing that even for a couple days before surgery can decrease complications after surgery.
And that's what my girls want. We want happy, safe surgery with a quick and easy recovery that doesn't have any complications. That's the number one thing I hear from my girls when they're looking for planning their surgery. How can I set myself up for success during recovery? And nutrition as well as mental preparation are probably the top two things that I'm always talking about. In your experience, what do you see? How do you see a patient who isn't fully prepared or optimized? What would their symptoms be post-op?
That's a good question. My main practice is breast reconstruction. And with that practice, I really do have the whole gamut of patients. I have patients who have just been diagnosed with cancer. Maybe they're just coming off neoadjuvant chemotherapy, or maybe they had their mastectomy 10 years ago and they finally decided that now's the right time for them to pursue reconstruction. So I've really seen patients at all different walks of life and health have surgery. So the things that nutrition can do are improve wound healing. So decrease the chances of wounds opening up. That obviously also sets you up for risk of infection if you have open wounds. So it's going to improve your wounds healing. It's going to decrease your risk of infection. It can decrease how long you're inflamed and swollen for, which is important for healing, but also just for comfort and decreasing your pain after surgery. So it really does impact the whole global healing response and also just the patient experience.
I love it. So for our listeners, how does increased inflammation increase pain? Just so they can understand. Me too. I want to understand how. How does that work?
Absolutely. Inflammation is an interesting thing. We actually need it to heal. We need an inflammatory response. It's bringing those healthy immune cells and the cells that are going to help you rebuild after having that surgery and that incision. But it's it's on a spectrum where too little is not enough. So for example, if you've just had chemotherapy and you can't mount that immune response, you're at an increased risk of infection. On the other hand, if you have prolonged inflammation, you're going to be swollen. You're going to retain more fluid. That can be very uncomfortable if you've just had an abdominoplasty or a facelift and you're swollen and uncomfortable. That's going to increase potentially how many narcotics you need. And our whole goal with surgery is to limit narcotic use after surgery. So it also has implications even for that, to limit how long you need opioids for after surgery.
And girl, do we know how sometimes those pain medications can cause other things that cause discomfort during the recovery period? So the less we can take that, the less other side effects we're feeling.
Absolutely. It's really a snowball or this endless cycle of things just feed off each other. For example, if you have, thinking about preparing your body for surgery, if you have a bad night of sleep, just one night of bad sleep, which we all have before and after surgery, it can increase objectively how much pain you feel and how many narcotics you need. Then you take narcotics, which results in decreased quality of sleep. So you have this cycle that is really hard to break. So if you can set yourself up for success and optimize your sleep ahead of surgery and decrease the amount of pain you feel after surgery, it's going to have a cumulative effect on your recovery and just how well you feel after surgery.
I would love to hear, doctor, what pushed you to really deep dive into this side of recovery? What was it? I want to know, was it like something that you saw? Was it a trend you were noticing, or how did this even come up to be like, I need to talk about this?
Yeah, absolutely. I have two quick patient anecdotes. So the first one, so I have a background of a PhD and it focused on vitamin D and inflammation. And so it was something that was always very near and dear to my heart, something that I had a lot of interest in. And in medical school, I distinctly remember I wanted to be a radiation oncologist. So I was working in a radiation oncology clinic, shadowing, and a patient during his radiation treatment was losing a lot of weight. And if you lose a lot of weight, you can't finish your treatments. So you actually can decrease even your survival outcomes. So maintaining your weight is so important. And so this patient was losing a lot of weight. He was becoming frail. And he and his wife asked the doctor, what can I do? Is there anything I can do? And the doctor's answer was eat melted ice cream. It has a lot of calories. And as a med student, you just like sit in the corner and don't speak unless you're spoken to. But even then I knew this is not the right answer. A protein smoothie, yogurt would have more nutrients with the same number of calories. So that was the first eye-opening event for me, in that nutrition really wasn't something that had worked its way into mainstream medicine a lot. So when I started my practice, I thought, you eat all the right foods, you're going to be fine. That's all you have to do. And then I had this one patient. She was a very young patient. She was 30 years old, diagnosed with a very aggressive cancer. And she had chemotherapy. And during chemotherapy, she got divorced. She lost her home because it was where she was living with her husband. Her stepson was took away. Her mom died of metastatic breast cancer. She was sleeping badly. It's a horror story when you think of all of these things that were happening to this woman. And she had a negative surgical outcome. Her tissue expanders that I placed ended up being exposed and we had to remove them. And I remember reflecting on that experience thinking, even if she was eating all the right foods, that wouldn't have prevented that negative outcome. She wasn't sleeping. She was stressed. She was anxious. She had just finished chemo. She had no social support. And that really was the turning point for me, that I thought, I need to discuss more than just nutrition with my patients. I need to really think of them from this global, holistic approach in order to truly optimize their outcomes and just improve their overall experience.
I love to hear that, how you saw something in front of you and you were like, okay, I got to do something about this. I was actually watching a movie yesterday called Heal, and they were talking about how our bodies can heal themselves. And there was an anecdote that they told of, it was people who had terminal diseases and how they were able to collect data of the things that they did that helped them reverse or like bring back whatever disease it was. It was different diseases, different scales, and they weren't able to collect all of the data of what they didn't do, but it was what they did do. And out of the 9 things that all of these people in this study did, only 2 of them or 3 of them were actually physical things of like changing their nutrition, getting more exercise. And I think it was like getting more sun, which goes to that vitamin D that we were
Exactly.
talking about. The rest of them were mental changes.
Mm-hmm.
And I thought
Absolutely.
I was watching that just yesterday and it really opened my eyes.
Yeah, it's something that we don't think about, especially if you're having cosmetic surgery. Let's say you're going in for a mommy makeover. You think of all the things like, am I eating healthy enough? Doing exercises before surgery. Those are some of the things that might be discussed by your surgeon. But how many people are saying, how much sleep are you getting? Who's going to take care of your kids after surgery? Who's going to be driving them to school when you have drains and it shouldn't be driving? But all of those things cause so much acute stress in the postoperative period when you're thinking, who's going to pick up my kid after school? That's very, very stressful for women.
Absolutely. That's actually when I started offering my services to people who would find me through my show. The top things that I'm helping them organize are the things at home when you come home, when
Mm-hmm.
you're after the surgery, and all of the logistics that as moms, a lot of times, and wives and business owners, we don't even think about all of these things that we're not going to be able to do over the next 3-4 weeks. And we're going to have to ask for help. And that's actually one of the top things that I noticed when I was a patient coordinator. My girls really struggled to ask for help with the
Mm-hmm.
people around them.
Absolutely. And not to be stereotypical, but women are often the main caregiver in the house and have those types of responsibilities, taking care of the kids, and oftentimes have a job as well that they're, very busy with. And it's interesting because very commonly, I would say in 99% of clinic visits, patients who are working will say, when can I go back to work? They will also ask, when can I pick up my baby if they have a baby? But they very infrequently ask, like, when can I pick up the kids after school? When will I be able to cook if that's part of their normal routine? And then after surgery, they're kind of surprised by they weren't able to do their day-to-day activities, what the family was relying on them to do. And then that is just an additional stressor and trying to figure out how to get that help for that period.
Absolutely. So for our listeners, since I have you, and you have done a lot of work on this. For people who are listening, who maybe are low, they just found out that they're low on vitamin D. What is something that they can do in their daily life to help increase that?
That is such a good question. You alluded to it before, was the sunshine. So spoiler alert, it is, especially early morning sun. But I think that a super common misconception and something that I see all over social media is the idea of what it means to be deficient in something. So let's say you go to your doctor's office and they draw your labs and it comes back as you are low in vitamin D. What they are looking at is they're looking at a normal range that is set in a range of just to prevent disease. So vitamin D is preventing things like rickets. Vitamin C is preventing scurvy. It's not promoting overall health and wellness. So for vitamin D, for example, the normal level is around 30 or so. If we're thinking about preventing diseases, decreasing inflammation, promoting overall wellness, it's 2 to 3 times higher than that. So even for patients that aren't deficient, if they have a stressor coming up like surgery, a period where they're going to be sleep deprived, jet lag, stressful time at work, they still could potentially benefit from supplementation. So things that you can do to increase your vitamin D would be a supplement, so a vitamin D supplement, taking it with K2 because K2 helps the vitamin D do its job, getting early morning sunshine, and eating foods that are high in vitamin D. So doing all of those things together. A supplement can't fix a really crappy diet, so it's important that you have that good foundation. But for many patients, especially in today's day where we're inside filming this podcast right now instead of getting sunshine, it's hard to get enough vitamin D just through our day-to-day lives.
It really is. Although if you're sitting by a window, sun's still coming through, so
That's
put your
true.
sunblock on.
Absolutely. Or driving a car. Absolutely.
Or driving a car, you're still getting some sun, so don't forget to put your sunblock on. One of the things that you've touched on quite a bit, which is something that I believe people who are having plastic surgery don't realize is going to be a thing until they're actually living it, is the lack of sleep at night.
Mm-hmm.
I know in my personal experience, when I had my surgery, I was awake almost, if not all night, at least a few hours out of the night. I was coming in and out of sleep, just not being able to get comfortable, just having discomfort, like feeling discomfort, just thinking of my drain, of this, of that, of don't put too much pressure here, make sure you're sitting right, like all of these different things that I wasn't able to sleep. And I remember in those sleepless nights just thinking like, oh my God, like everybody else's life is just moving on, moving forward the day to day, but I can't even sleep.
Yes, that is so common. And I think it's easy to forget all of the things associated with surgery that negatively impact sleep. One of the things you touched on, and what I hear all the time, is you're told to sleep on your back for 4 to 6 weeks, and you're a side sleeper or a belly sleeper, or you're told to sleep on an incline. You have drains, you're in pain. If you're in the hospital, you have bright lights and loud noises and nurses checking your vitals every 3 hours. Pain medications, it's all of these things. And so what is so important is to get in a good sleep routine before surgery. So good sleep hygiene, making sure that your environment is conducive for sleep. So cool environment, dark environment, noise reducing headphones, white noise machine, aromatherapy, using your bed just for sleep so that you're not doing work and associating your bed with your work and stress. Because if you don't have those tools in your toolbox before surgery, when you're after surgery and in pain and you're sitting there thinking about whether or not you're getting an infection, you're really going to have bad sleep. And sleep is so important for healing from surgery.
Absolutely. I'm so happy that we touched on that. I know I hear it from my one-on-one clients when they're sending me messages in the middle of the night of like, I can't sleep. What do I do? And I wish I had the solution, but what you're telling us today are some really good steps to get ready. So sleep hygiene. Definitely one of the things that I like to tell my girls is load up on books, because one thing I can do is I can read until I fall asleep.
That's true. Because I think we're all guilty of this, but you wake up, you can't fall asleep. What do? You pick up your phone. You start playing on Instagram. So now you have this blue light coming in. You see something that upsets you on Instagram, and it just fuels this spiral of not being able to sleep. But I think if you pick up a book in the middle of the night, it will put you to sleep after a couple pages.
It'll put you back to sleep. You touched on something, which is they go online. And what happens in my experience, what I've seen is they go online and they're looking at the Facebook groups and they're comparing, oh, this girl's 3 days post-op too. And she looks way better than me. She's not as swollen as I am. Like, what's wrong with me? Am I doing something wrong? And then it just snowballs, or they'll see somebody who's dealing with a seroma and all of a sudden they think they have a seroma too. And so you guys, I know that y'all love the Facebook groups, but sometimes they make more problems. They cause more problems than what they solve, because although consciously you're not thinking that you're doing it subconsciously, all you're taking in all of this information and you're worrying yourself of things that don't even have anything to do with you.
That is so true. And early in my practice, I joined a lot of these open access Facebook groups, and it was very informative to me just to read what patients were concerned about, learn some vernacular that we didn't learn in med school or residency, like, the drop and the fluff, and just realizing so that we could have good conversations in clinic. And what I would see time and time again would patients putting up photos of a red breast after a breast augmentation and saying, is this normal? Should I call my doctor? Don't get medical advice on social media. That is the first thing. And then I think also, like you said, people are putting up edited photos or unrealistic expectations based on different people's outcomes. So I think that, especially for breast cancer patients, social media can be a really great place to get a network of people. Get that virtual support, especially if you don't have anyone in your life that can give you that support. But it is not a place to go to compare your results to others, get unrealistic expectations, or ask for medical advice that could potentially worsen a situation if you are getting into a situation where you have some type of complication.
Absolutely. So I'm going to take advantage that I have you on the show, and we have actually not ever touched on this subject on the podcast, but I want to take the opportunity to. For my listeners who are possibly dealing with a breast cancer diagnosis, and maybe they just found out, or maybe they're already in treatment, and I want us to talk about breast reconstruction after a breast cancer diagnosis. I always like to pretend like we're in a consultation so that our
That's
listeners
great.
can hear some of the questions of like, what are my options? What can I do? My listeners know, my girls know, I always talk about board certified plastic and reconstructive surgeons. And well,
Mm-hmm.
here's where the reconstructive part comes in, you guys. So this is where the reconstruction happens with breast cancer patients. And so one of the questions I have from as if I were in a new consultation is, what are my options?
Mm. That is why our consultations are an hour long, because the good news is that for most patients, there are many options. So I think that when I start my conversation with breast cancer patients, regardless of where they are in the journey, new diagnosis, coming in for a revision, never had any type of reconstruction, there are a couple points that I think are the biggest take-home points. One is that breast reconstruction is always optional. It's not saving a life. I'm not removing a cancer, but studies have shown for women, it can improve your health-related quality of life. It can improve how you feel about yourself, but it's always optional. It can also be done at any time. It doesn't have to be done at the time of the mastectomy. So for some women, they come in, they've had this crushing diagnosis. They're having chemo. They can't make a choice about what type of reconstruction they want, and they just want to go flat for a little bit. And that's okay. The other thing is just setting realistic expectations. And I like when patients bring in wish list photos, even if they're completely unrealistic. It sets up a good framework for us to have a conversation about what is possible and what is not possible based on their cancer, their body habitus, their goals for reconstruction, how many surgeries they want to have. But I think that that's super important too, is to have conversations with your surgeon about what is or isn't possible or safe. And then the other thing is, what is my goal as a reconstructive surgeon? So a lot of times patients don't undergo bilateral mastectomy. So they only have the cancer breast removed. And their big concern is symmetry. It's hard to get complete symmetry if you have different things. Breast implant, implant flap, whatever combination. My goal with reconstruction, and most plastic surgeons' goal, is that when you're in a well-supported bra, whether it's a swimsuit or just a well-fitting bra, you have good volume symmetry, and it doesn't look like you're walking down the street and someone's like, she had breast cancer surgery. But it is important to know for most patients that they will look different without clothes on. And those are, I think, the biggest take-home points. And then your main question was, what are options? So there's really three options when you think about breast reconstruction. One is implants, and that's what most women choose because it's a shorter procedure, a faster procedure. It can often be placed at the time of the mastectomy. It's like having a car, though. They do require lifelong maintenance, just like if you had an augmentation. The second option is using a part of your body that's expendable. We often use lower abdomen, we can use thighs, and you make a breast out of your body. The pro of that is it's your body. It ages with you. The con is it's a bigger surgery. Second area of potential pain and complications. And then the third thing that I think is often left out but should be discussed is an aesthetic flat closure or a Goldilocks approach, which is just rearranging tissue to make the woman either completely flat or have a small breast mound. But in my view, that's still reconstruction. It's something that's done thoughtfully and methodically in order to give a woman the appearance that she desires. So long-winded answer to your question.
But that's great. That's exactly what I wanted to hear. I love that on the podcast platform, women who are listening to these episodes can really get to hear the care behind the plastic surgeons who are doing the surgeries. Usually they don't really get to know the person until they're in the office, until they're having a consultation. And that's why I love this platform so much, because the listeners and my girls can get to hear the warmth and get to hear the care. They get to hear the personality. And that's really how I feel surgeons and patients connect, by really getting to know that the other person, for example, if you're a patient, that your surgeon really cares about what they're doing for you.
Absolutely. And as a plastic surgeon who does breast reconstruction, I will follow these women for the rest of their lives because they'll need revision surgeries and implant surveillance. And so I really do get to know my patients over time. You know, we talk about our families and we go on vacation and we work through triumphs and failures together. So it is the part of my job that really gives me the most joy, in that you really do build relationships with these women and you see them at their lowest. And the goal is to get them to a place where they feel comfortable with themselves and back to a new baseline, wherever that is for that woman.
I love it. So before I let you go, how can my girls find you?
So I started an Instagram page, and the whole reason I started an Instagram page was because I so strongly believe in all of these messages that women and men should be empowered to impact their surgical outcomes and their recovery. And as an academic plastic surgeon, I just don't have time to discuss these topics with patients. So I wanted a place that I could reach more people and spread the message. So I have an Instagram page. It's at surgical_recovery. And it's really on all, YouTube, TikTok, Threads, all the usual social media platforms. But I love answering questions and, delving into topics that people have interest in. But it's really a way that I found that I can, like in podcasts like this too, is reach more people than just the patients that I see in clinic.
I love it. I love it. So you heard it here, ladies. If you are having questions about anything that we talked about today, you can reach out to her on Instagram and she will definitely answer you. And with that, I will see you guys next week. Thinking about plastic surgery, but you don't know where to start? I've got you. With 18 years in the industry and experience working with top board certified plastic surgeons, I help women like you make informed and confident decisions. Whether you need help choosing a surgeon, planning your recovery, or understanding what to expect, I've got your back. Skip the guesswork and get expert guidance by booking a call with me today. That's a wrap for this episode of Big Butts No Lies. If you found this episode helpful, do me a favor and subscribe, leave a review, and share it with a friend who's considering plastic surgery. Until next time, stay confident, stay informed, and remember, big butts don't lie.